Okay, we're recording.
Okay,
and,
we're recording.
I think we're ready to go, right? I think we're ready to go.
Did you make me co-host, Rabbi?
I just want to go take a Pepsi. Hold on a minute. 1 minute.
A Pepsi break.
Pepsi break. Okay.
Pause for a Pepsi.
Brian, you should be host.
Okay, cool.
And we're
All right,
recording.
because
We're
I know
going.
sometimes on weeks to come, firstly, let me say thank you. 3 people entered the waiting room. Now I have to do this, right? So admit Miriam, Gail, Melody, and Janet Seidel. Wow, fabulous. So welcome everybody to this. We're calling it the first, hopefully, of many, but being that it is the first, it's somewhat of a trial balloon. We want to thank Michael Mantell, who has run similar programs in the past, to give us the idea. We have such a wonderful group of people in our shul to draw from in terms of experience in the health and wellness field that we hope every month to be able to feature someone who is a member of our shul to give us advice, give us the state of the art, or give us words of inspiration relative to their field. The program will start with some words of Torah from Rabbi Reich regarding the general subject of wellness and health and what the Torah has to say. And then we will hear from the specific guest speaker month by month. If and when, please God, we should all be back in person, we would also want to follow that up with a little walk on the beach where we can all meet together and maybe have a cup of coffee and walk on the beach. So that will be coming up in the future iteration, please God, if this all works out as planned and we get some traction and everybody starts to, if it becomes something that we hear back from the community, they'd like to continue. So with that said, welcome all. It's the Marcus and Reich program today. No relative of mine will go with, a relative of mine has to take the first spot, right, Sam? It's the Marcus and Reich thing.
We don't go unnoticed.
Won't go unnoticed. So, Rabbi, over to you. Thank you very much.
Thank you so much, Brian. Just to make things simple, I added a middle name for myself this morning, Marcus. Thank you so much, Brian, for getting the program going. And thank you so much, Dr. Sam Marcus, for being our first host who is going to be sharing some words of wisdom and having a healthful gut. And I was thinking about it this Shabbos while I was having my kugel, because you know that kugel has the same gematria, as the same numerical value as the word Shabbos. So those that are quick with gematria, those that are quick with adding up numerical values in the Hebrew language, will right away do the math and say to me, Shabbos is not the same gematria as kugel. So what do you mean Shabbos is the same gematria as kugel? Well, if you have more kugel, then eventually you go up to Shabbos, right? So I of course just kid, and it's a interesting thing. The Torah tells us v'nishmartem me'od lenafsho seichem, that we have to be scrupulous. We need to be diligent. We need to be extremely cautious when it comes to our health and living a healthy lifestyle and making sure that we take care of our bodies. And in fact, the Torah does not use the word me'od when it comes to other areas. It uses the word me'od. You have to be very careful when it comes to your health. And nishmartem me'od lenafsho seichem. But there is a pasuk in Sefer Tehillim, the Gemara quotes, that says, Shomer Pesayim Hashem, that God watches over the fools among us. So what does that mean, that God watches over the fools among us? So Rav Moshe Feinstein used this pasuk in Sefer Tehillim as a source for a person who is not so well versed in diet, in proper diet and taking care of themselves. Specifically at the time, he was referring to smoking.
Yes, it's
That a person, if we could ask everyone to please mute themselves. Oh, perfect. Okay, here we go. So Rav Moshe Feinstein, in the context he's discussing, is smoking, where someone asked the question to him, is it okay to smoke? What's the Torah's perspective on smoking? And he says that he gives a number of different reasons why it'd be prohibited to smoke, because number one, it is not good for you. But at the time that he was addressing the issue, it was not a universal acceptance that smoking is something that is bad for you. So therefore he said, now those that still feel that it's okay to smoke, Shomer Pesayim Hashem, God watches over the fools. Basically, what's Rav Moshe teaching us? Rav Moshe is teaching us that a person can choose to be ignorant as long as they are not going to be actively destroying their lives. But who wants to be considered an ignorant person? Who wants to be considered a fool? No one wants to be considered a fool. So therefore, it's very important that we do these kinds of programs, that we learn from the doctors in our community, the medical professionals in our community, how to take care of ourselves in order so that we are all doing the best we can. Now, what gives us the right is the next question we have to ask, to even go seek medical attention. I know the Torah says, we have to take care of ourselves, meaning we can't actively do things that would destroy our health. But let's say once I'm sick, so what gives me the right to go to the doctor? And I'll tell you why we ask this question, for two reasons. Number one, the Ramban says, because one might think that I don't have the right to go to a doctor, because ultimately, who is the one that provides all healing? God. And therefore, I don't have the right to go to the doctor, because I have the ultimate chief of medicine up in Shamayim that's running the world. And if he chooses that I'm sick, then I don't have the right to go to the doctor. Then this is what God has chosen for me. This is the path he's put me on, and therefore I can't go. Number two, the Ramban says, which is a very, very intriguing argument. He says the doctor would be playing God. Let's say the doctor messes up, not to say, God forbid, that Dr. Marcus would ever mess up, but let's say the doctor messes up and gives inappropriate advice, makes a mistake in surgery, the like, and the person ends up getting sicker. That's a big problem, because now the person may have blood on their hands. So what gives the right to the doctor to do it? Says the Ramban, based off of the Gemara Bava Kama, says the Ramban that the Torah tells us that when a person gets sick, God gives permission to the doctors to heal. Not only does God give permission to the doctors to heal, it's a mitzvah l'rapos. It's a fulfillment of a positive commandment for a doctor to step forward and provide medical assistance. And this, he says, this is an unbelievable thing. If there's any Torah to learn from this, this is the Torah you want to walk away with. We know that there's a mitzvah, says the Rambam, of hashavas aveda, returning lost objects. As the Torah says, v'hashivos alo, you have to return the lost object that the person loses to them. It's like, I lose my basketball, so the Torah said, and you find my basketball, the Torah says you are obligated to return my basketball. Says the Ramban, v'hashivos alo, if the doctor has an opportunity to return, to restore someone's health, it's much more important than a basketball. It's much more important than any monetary object the person may have lost. This is a person's health. And therefore, it's incumbent upon the doctor, in order to fulfill a mitzvah of restoring, helping, being a shliach, a agent of God to help restore that person's health. So it's a great honor for us to ask Dr. Marcus to fulfill this mitzvah of hashavas aveda, of returning restoring some proper perspective on how to take care of ourselves, coming off of Shabbos as we want to restore our gut. And we turn the screen over to Dr. Marcus. Thank you again so much for your time this morning.
Thank you very much. Such a nice introduction and enjoyable brief share. Of course, the Rambam was one of the earliest who really tried to make people understand it was obligatory for them to look after their health. Otherwise, they would not be able to be well enough to look after their obligations between themselves and Hashem. The way I want to do this forum is really question and answer. So the parenthetical title to this talk about a healthful gut is really everything you wanted to ask about the gut and that you were too afraid to do so. So I'm really opening it up to the floor for people to feel free to ask me any questions that have been worrying them, or they just have an interest in and like to have my perspective on GI health.
So Dr. Marcus, I have a question. If it's okay with everyone if I lead it off over here. Something that I've always wondered is from a gastroenterologist perspective, when it comes to dieting, there are so many different diets out there. Atkins, keto, South Beach, there's these diet plans like Optavia and all these different ways that people try and lose weight. From your perspective, two questions. Number one, are any of them potentially damaging to your health? They may cause you to lose weight, but what kind of effect will it have on your digestive system in general? And number two, what in your opinion is the most appropriate from a medical perspective diet to approach in life?
That's just a very hard question. The problem about all diets is not so much about always being able to lose the weight as much as it is to keep the weight off once you've lost it. And some of that really depends on what's called the set point of what your body thinks your weight should be under normal circumstances. And if that set point is set too high, then your body weight is automatically going to gravitate towards the elevated set point. And there's been no treatment available as yet that can lower that body set point. So as I say, we can lose weight, but then to maintain the weight loss is particularly difficult. All these diets are effective to a greater or lesser extent to help you lose weight, but it's the maintenance afterwards which is so difficult. And the research on this is really still in its infancy, but a lot of it has to do with certain hormones in circulate in the body. Obviously, you've all heard about insulin, but there's other hormones that affect appetite, such as ghrelins and leptins. Some stimulate, some reduce appetite. Some of the new drugs for the treatment of diabetes is really based on adjusting these hormone levels in your body. So, but it's still, to go back to the original question, is how do we maintain the weight loss is still a challenge. Now, obviously, what's in vogue now is the role of the gut microbiome, the bacteria in the colon, how they affect weight. And we know in animal studies that if you take genetically designed mice that easily become obese, and then you take normal mice and you swap the gut flora from the normal mice into the genetically obese mice, then we know that these are genetically obese mice can lose weight, and vice versa. If you take the gut flora of these obese mice and put them into the normal mice, they gain weight. So we certainly understand there is a role between the various different breakdown products of the bacteria in the gut and how they affect weight gain, mainly through the liver, through increased amounts of lipids going through taken up by the receptor cells on the liver, which can be somehow ameliorated by the bacteria. And there may well come a time where we will be able to adjust weight by modulating intestinal gut flora. The problem is, again, is if you stop doing whatever you're doing to cause this change, everything reverts back to the way your gut flora used to be in the beginning. So you know, whether or not we're able to feed ourselves with certain type of probiotic, because this is what essentially we're talking about, or perhaps prebiotics, remains to be seen. But as I say, there's a lot of animal work going on which seems to suggest that the gut flora does seem to have an important effect on weight gain. There's been a few anecdotal case histories of patients who suffer from a condition known as C. diff colitis, Clostridia difficile colitis, which is quite common, usually related to antibiotics. And if you're in hospital and you develop diarrhea within about the first 4 days, after the first 4 days, it's often due to this condition called C. diff, which for various different reasons can be very hard to eradicate. But one of the ways of doing so is by doing what we call a fecal microbiota transplant, where we actually take dried bacteria from the feces of healthy people and we use a colonoscope, and we then inject the solution back into the colon, or sometimes we even give capsules by mouth. This can be very effective in restoring gut health, but it's also, there's been some reports where patients noticed that they've started to gain weight, which they well above what they used to be, and the assumption is because the bacterial flora of the one of the mixtures of probiotics was taken from an obese person. So that's not probably the answer you wanted to hear about what's the best diet and how to keep the weight off, but that is the state of things as they stand at the moment. In terms of a healthy diet, I usually encourage my patients to eat what's known as the Mediterranean diet. And there's a few variations on this. There's one called the DASH diet, which is supposed to be particularly heart healthy, and a one called the MIND diet, which is supposed to be helpful in reducing Alzheimer's. But they're all based around less red meat, more fish, more chicken, more whole grains, more salads, more greens, more multicolored vegetables, more fruits. And although berries are in vogue at the moment, I suspect other fruits were probably just as effective. And of course, with the Mediterranean diet, you're allowed a glass of wine every day, plenty of olive oil. dairy is losing its popularity again because of the saturated fatty acids in it. So we shouldn't be eating too much dairy. Coconut milk is definitely a no-no. That's just a fad. Should be avoided, full of saturated fats. And let me see what else. Eggs seem to be okay with, as long as not in excess, because we kind of, there's always been an egg issue in the past, but particularly for little kids, because it contains a lot of choline, which is important for brain development. So that's what I have to say about the subject.
Very helpful. Thank you.
Are there any fruits and vegetables that you shouldn't be eating? I hear this all the time about things that you should avoid.
Well, no, unless of course there's specific medical reasons why you might need to. For example, there's a lot of misinformation about the condition known as diverticular disease, which 50% of the population has by the time we reach 75, which has lots of little pockets in the lining of the colon, which is the large intestine. And in order to reduce the risk of these pockets getting inflamed, that's known as diverticulitis, there's been a lot of dietary recommendations over the centuries about what is the best thing to do. And at one point, there was a whole thing about avoiding seeds, which of course, if you avoid seeds, that pretty much wipes out many fruits. But what I usually tell my patients, if they eat an apple, spit out the pits like most of us do normally. Likewise with an orange. Strawberries are fine. Fruits with little seeds are fine, like tomatoes. I just avoid things like popcorn. And if you're going to eat nuts, chew them very well into a paste and don't just shovel them down the back of your throat. But other than that, I try to avoid restricting people's intake of fresh fruit.
Sam, there are a couple of messages on your chat, questions on your chat. One from Adam Dragowitz. Adam, if you want to pose the question to Sam directly.
Sure. Hi, thank you. I actually had a couple questions, but one of them was asking about this FODMAP diet, if you've heard of that, which is the low sort of oligosaccharides. And it was kind of strange to us that it seems like some of the things to avoid are kind of strange. And then the other question I had done earlier was, when you say don't eat too much dairy, how do we understand too much? So thank you.
So the latter question about too much dairy, probably milk and tea or coffee, maybe in cereal, low fat milk or skim milk, not too much cheese at all. Maybe one piece of cheese. That's about it. Really, maybe an ounce or so. In terms of the FODMAP diet, the FODMAP diet sometimes can be helpful in patients suffering from the condition known as irritable bowel. It's very, very common. It's probably one of the most common types of GI disorders, and everybody suffers from it to a greater or lesser extent if their threshold for triggering this condition is exceeded. For those people whose symptoms are not settling down, sometimes a FODMAP diet, which essentially is an elimination diet of certain foods, mainly vegetables and fruits, which should be avoided from the diet, taken out from the diet, and then after about 6 weeks, if the patient's feeling well, gradually reintroduce it one food at a time. It's not supposed to be a long-term diet for the rest of your life, which I do see with some patients, and it can be quite dangerous because they can develop this eating disorder known as avoidance food restrictive intake disorder, where you cut out one food, then you cut out another, and you think, oh, this food's upsetting me, I better cut it out, and then you carry on, oh, this food's upsetting me, I better cut that one out, and in the end, you're just living on lettuce. So, and I have seen this. So probably one of the single most important thing I try to make sure of my patients who are on a FODMAP diet is that they after about 6 weeks, they start reintroducing the foods that they're used to taking in the past. I tend not to prescribe a FODMAP diet too frequently because it's a hard diet to adhere to. And most times it's trying to reestablish a different gut flora in the colon, because a lot of the symptoms of irritable bowel can, not always, but can relate to the composition of the gut microbiome, which maybe we should talk about a little later on. But I hope that answers your question, Adam.
Yes, thank you.
I was wondering about not having as much fruit and consuming more vegetables because of fructose, and that's basically still sugar.
Yeah, so fructose in sugar, fructose in fruit is fine. Okay, fructose in orange juice or other juices is not fine. Mm-hmm. Because the way it's all to do with how fast it's released, and when you take fructose in say orange juice, that gets absorbed very quickly, and you get a surge of fructose gets broken down into glucose and galactose. You get a surge of glucose, and then the insulin starts rising and surging in excess. So are we still here?
Yeah.
Yeah.
We're all still here.
So it's the smooth rise and fall that we're trying to obtain. It's the rapid peaks and then the overshoots into troughs, which is unhealthy. So I personally have no problems eating as much fruit as I like. And maybe I'm getting a little bit too much fructose, but it's a hell of a lot better than drinking all these fruit juices and odwalas and everything else.
What about flavored waters? Is the like the 5-calorie flavored waters and sparkling water? Some people say sparkling water in general is not good for you. The carbonated waters do you have any opinion on that, Sam? Carbonated versus non-carbonated water.
Well, first of all, the reason why it can stress the gut, which doesn't stop me drinking it, is because the carbon dioxide gets broken down. It gets dissolved into carbonic acid, and that's acidic. So if you're predisposed to acid reflux, it's more likely to make it worse. And also, if maybe if you have a history of an ulcer, which sometimes can be due to excess acid, but the story is a lot more complicated than that. Again, carbonic acid could be a potential a problem.
I think we have a question from Paulina on your chat. Paulina, are you there? You want to ask Paulina? I can ask the question that Paulina had. Let me just go to the. Oh, there she is. Okay.
Hi.
Hi, Paulina.
Hello, everybody. Thank you so much. I think it's a brilliant idea, and thank you again for doing all of what you do. We say in Russian that everybody has an opinion about health and art, so we know everything about health and art. But I really appreciate the opportunity to ask these silly questions. I heard that our digestion starts in our mouth. That saliva is actually digesting, helps to digest everything. So the amount of chewing, how many chewing we have to have for every bite, and do we have to chew meat? Because I heard that enzymes that help to digest meat are only in our stomach. And another question I have is about separate diet. I heard that it's really a smart idea to not to mix protein and carbs. Thank you.
Very good. So what was the first question about saliva? Our digestion does start in the mouth. The saliva that is secreted by the glands under your chin and behind the angle of the mandible and here, which we call the parotid glands, they secrete an enzyme called amylase. And amylase helps to digest starch in your diet. So that's the first part of the digestive process. In terms of how much you should chew, you should chew exactly 101 times. So the reality is your mastication is chewing. That's pre-digestion of the food. So obviously you want to be able to chew it into a paste. So not only does that allow you to safely swallow the food bolus, because obviously if you try to swallow large pieces, you're going to choke. But also with the salivary amylase, it's the first step in the digestive process before food reaches the stomach. Once the food.
So one of the questions was, does that apply to meat as well, since meat isn't a starch?
The amylase in the saliva will not, but the saliva is required to help. Just imagine how difficult it would be to chew without having lubrication in your mouth, and how difficult it would be to keep that piece of meat that you've ground up by chewing into essentially into a small ball, because that's what happens with your tongue. You chew with your teeth, and your tongue makes the food bolus into a little ball, and then the tongue muscles and the swallowing muscles then allow it to move down the throat into the esophagus. To keep that little bolus of food, that little ball of food together, you need the saliva. So although it may not be directly important in digesting or pre-digesting the carbohydrates that you've taken in your diet, it's certainly important in allowing you to make this food bolus and then swallow it easily. And there are conditions where people can't make enough saliva. It can be a very difficult problem for them. So in terms of digestion, so the stomach continues the work of the mouth and the teeth in terms of making the particles of food even smaller. And that's called titrilation. And the acid in the stomach is not as important as a lot of people think. You can digest your food well enough without acid. The acid is actually designed there to kill the bacteria that you've ingested, which have been coating the food or on your fingers. It's less important in terms of breaking down the food. into smaller particles. The more important is perhaps the enzyme pepsin, which is also designed to break down food and is released from the lining of the wall of the stomach. But the single most important organ for digesting your foods, whether it is carbohydrates, fats, or protein, is the pancreas. Because the pancreas does two things. It makes insulin, which we touched upon before, which controls the amount of blood sugar that you have in your circulating your bloodstream, and allows normal transport of glucose out of the bloodstream into the cells. So insulin is sort of like the doorkeeper. It opens and closes the door to allow transport of glucose into the cells. And if it's not working effectively, then the glucose in the blood vessels are too high and can start causing damage to the blood supply itself, the blood vessels themselves. The other thing that the pancreas does is to make all these digestive enzymes, including proteases, which digest protein, and lipases, which digest fats, and different ases that digest carbohydrates. So when you come to the question about milk, protein, and what was it?
Carbs.
Yeah, I don't see an issue with this at all, really.
Sam, that sort of
Physiologically, it makes no sense to me.
so Sam, that kind of raises. I also had a question as to whether, is there validity to the fact that obviously vegans and vegetarians claim that their diets are much healthier than us regular carnivores, and that we should all be vegetarians and or vegans and eat organic foods only, and keep our bodies alkaline and not eat too much acid. And what do you have to say to I mean, I hate to call them health nuts, but some people who are particularly health conscious, who come to these conclusions that us carnivores are killing the planet and killing ourselves.
Right.
I mean, we're all going to die anyway, but are we killing ourselves sooner than we need to?
Well, we probably are, because we just eat in excess. But whether that's to do with a vegetarian diet or omnivore diet is somewhat debatable. You bring up very interesting points. First of all, vegan diets on their own result in nutritional deficiencies, in particular iron, vitamin B12, vitamin D. And I have a lot of Asian Indian patients who, whatever they come in to see me for, these are the basic things that I check them for. So being on a strict vegan diet is not necessarily conducive to a healthy life. A vegetarian diet, I mean, I once had a young woman, this is a while ago, who told me she was a vegetarian. I just happened to ask her, what does she eat? And she eats chocolate and Mars bars and potato chips and so on. These are all vegetarian. So, of course, it depends what one means by the diet. But in general, I have little to criticize a vegetarian diet, except you can become deficient in vitamin B12, which you can only really get in maybe poultry and red meat, perhaps some fish. So my mind is that everything, it should be a balanced diet, and you don't have to eat, you shouldn't be eating red meat every day, maybe once a week. But I wouldn't necessarily say you have to completely cut it out. Really, I don't believe that we should necessarily not eat fish or poultry. I think it's really essentially it's a balance, and in order to eat a healthy vegetarian diet, you have to derive your protein from lots of beans and lentils, which are extremely healthy, but you have to do it, and not from carbohydrates. So,
Right.
So that
And
was,
is there,
what was
and
the other point you were making?
well, organic and
Oh.
keeping your body alkaline, and
Yeah. So first of all, you don't have to worry about keeping your body alkaline or acidic or whatever. That's because you got chronic kidney disease, because the kidneys are intimately involved in maintaining your normal acid-base balance. Okay. So all this business about taking things in alkaline, if it's too alkaline, then all that happens is the kidney adjusts it. So it's a complete waste of time, effort, and mental energy in trying to decide how to do it. You know, if you happen to have certain types of kidney stones, sometimes we recommend that you should avoid foods that contain oxalic acid, like strawberries and so on, and that can have an effect on, you know, the acidity of your urine. Sometimes we do want to make the urine more acidic or more alkaline, but as a general rule, don't bother. It's just not necessary. I certainly don't think twice about doing that. Now, the other thing about organic foods, and we can throw in GMO at the same time.
right.
You have to try, first of all, you need to separate the politics from GMO to the actual food product. The food product itself is 100% safe. And when people are putting on their food non-GMO, it's a marketing thing. Just like you can get gluten-free water. I mean, you know, it's the same difference, really. So I think, you know, GMOs have saved the lives of millions of people in third world countries because of it, because of the way they've been genetically modified to resist drought and various pests, you know, pests and viruses. So I think in many respects, the GMO foods themselves are safe. Well, the political side is about how the companies make sure that these seeds can't be fertilized. So that means they have to have a constant, that if you're a farmer, you constantly need to keep buying them, because you can't keep some aside to use for raising your next crop. Is a different question where they're criticized. But on the other hand, they're criticized about, well, if you make these seeds fertile, then what about the spread to other crops? And then we're going to have our standard crops now cross-pollinating with GMO crops. So you're between a rock and a hard place in terms of the manufacturer. They're damned if they do, they're damned if they don't. But generally, I think GMOs have been given, to some degree, an unfair deal. I think Prince Charles is probably one of the main anti-GMOs from maybe 20 years ago or so. He certainly started giving it a poor reputation. And I'm not trying to protect it in terms of, as I say, the politics of it, but in terms of GMO foods, I think they've done an amazing thing. They've saved the lives of millions of people in the subcontinents of Africa and the Sahara. So whether or not we need to eat GMO foods here in the land of plenty, that's a different question. But in terms of, are GMOs safe? The answer is yes. They're not going to kill you if you eat them.
It's not a question of killing, it's what you do to the environment.
I'm sorry? Yeah. I'm sorry, somebody made a comment.
Jack, did you make a comment?
Jack, I think Jack made a comment.
Oh, me?
Yes, I heard you.
I didn't know. I thought I was muted.
Ah, you got to
Yeah,
be
I
careful
know.
what you say.
That's a moot point, but no. So I was just commenting to me under my breath about it's not a question of how much good they've done health-wise for people. It's a question of what they might do to the environment generally.
So again, Jack, a lot of this is to do with politics.
Well, I know, but I mean,
So
I
I
know.
want to keep out the politics.
I know
want to
you're
keep-
supposed to talk about the gut, so I wasn't going to bring that
Yeah.
up.
But this is that's why I'm saying GMOs are a very political hot potato. So, but I was going to answer.
Potato. It's a potato.
Oh yeah.
It's a potato.
Listen,
Now let's go
Jack
back.
was the one that had the guts to bring it up. So,
So back to the other question about organic. So again, I've heard some pretty highly regarded people speaking about organic foods. Probably the first person I heard speak is a guy from Stanford called Amy's, and he did the Amy's test that all little babies get when they are born to make sure they don't suffer from metabolic disorders like phenylketonuria. And he was against organic foods. Since then, there was a study done more recently at Oxford University about the lack of benefits of organic foods over our typical foods. And a lot of nutritionists don't really see any overall benefit. The premise is that organic foods make their own pesticides within the skin and in the flesh of the fruit or vegetable. So it's not as if they're pesticide free. They just happen to be more effective in making their pesticides than the usual fruit and vegetables that we eat. So the general thought is, as long as the fruit and vegetable properly washed, so you remove it from the skin, any of these pesticides and toxins from the skin, they're probably just as healthy to eat as the organic. And again, not everybody can afford to pay for organic food, fruits and vegetables. There's an added expense. So I actually take great pleasure of comparing when I ever go out shopping, which is rare. But if I go to Trader Joe's or whatever, usually when I'm here in San Diego. But if I take great pleasure of comparing the prices of organic versus non-organic foods, and then buying the non-organic and feeling that I've made some money. Because I don't honestly believe there's a real true benefit. And I see a lot of patients who can't afford organic foods, but they really think they have to do it. And if you look at those organic foods and vegetables, I mean, if you remember when they first came out, they looked really ugly. They looked like mutant fruit and vegetables. Do you remember how ugly they were?
Oh yeah.
And now they're looking a bit more like regular fruit and vegetables, which only brings me to conclude that if they're looking more like regular fruits and vegetables, then maybe they are more like regular fruits and vegetables. So I'm a little skeptical. Now, of course, if we could bring the cost down and provide good quality fruit and vegetables by organic farming, I would not say no. But at the moment, it's food for the those who can afford it, and that's not what it should be about, really. I remember when I first came to America, I was astounded. We're California, about the how beautiful the displays were of fruit and vegetables, and how shiny the apples were in Vons, where they had spotlights on them. It was like it was a whole experience. Of course, we're not supposed to be eating those foods now because they're not organic. But believe me, if you wash them properly, they're very healthy.
Yeah.
Sam, can I ask you a quick question? This is a time when so many people have increased anxiety, worry, depression even, and everyone's looking for a way to feel better. There's a lot written lately about diets that lift our spirits or calm us down, diets that can make us feel more anxious. Can you talk about foods that can help in terms of emotional well-being?
Chocolate.
Yeah, it is chocolate.
But I'll get a bar right now.
But the reason why chocolate is so effective is it gives your serotonin a boost. You know, the feel good hormone. You know, so for concentration, caffeine is always good. I'm getting an echo. Is that because of you?
No.
Joanne needs to turn off her mute. Joanne needs to mute.
Questions on acid reflux.
Joanne, Sam, tell Joanne to mute hers. There you go.
She insists she's muted. I said your microphone is muted. Yeah. Okay. Yeah. So this is not really an area of my expertise in terms of the feel-good diets, but I do know that chocolate makes you feel better, and caffeine helps you concentrate, and there's probably no harm drinking up to about 3 cups of coffee a day. It's supposed to have some potential anti-cancer benefits as well. But apart from that, Michael, yeah, you'll know more than me. Yeah.
I think, Sam, I don't know if there are any last questions, but this is like the 1-minute call. We've been at it for almost an hour. So anyone
really
want to pose the last question? Yeah. Can you believe that, Sam? It's almost an hour. Anyone else, or any last words, Sam? I mean,
well, does anybody want to ask about acid reflux, colon cancer, H. pylori stomach infection, and peptic ulcer disease? these are the.
Dr. Marcus, I'm just so impressed that you could answer all of those questions in a matter of a minute.
Oh, I can't. I'll have to pay for another hour. I'm not Rabbi Hillel.
So, yeah, so you're telling us no more cholent on Shabbos, and yeah, beans are good.
Nothing in excess. So when we were in the Hague, we may only you have to realize all these foods we eat in large quantities, sometimes too frequently, we're at once a week and in much smaller amounts, because that's all they could afford to eat. And it's because half the time they were starving, they could afford to eat some of these very carbohydrate-rich and fat-rich foods.
Right.
But the rest of the week, they were living on air. So it's a completely different situation. They weren't going to be dying of heart disease. They were more likely to be dying from infection, tuberculosis, pogroms, that sort of thing.
Hopefully not.
But it's all changed. So we have to keep, it's all, we love all these foods, but we have to, again, try and eat in moderation, just like we all know. We all know everything should be middle of the road and in moderation. But you know, the preserved foods are not necessarily good because of the nitrites in salt beef and pickled cucumbers and so on. If there's nitrites, that's a problem, because if you don't have very much acid in your stomach caused by H. pylori infection, it's very common in our predecessors. And those people from second and third world countries often have it now. If you're in a first world country, it's less likely. But when you have chronic H. pylori infection, it cuts out the acid, cuts off the acid, and then the bacteria I was telling you about beforehand can flourish, and then they can break the nitrites down in the preserved foods that we sometimes like to eat into nitrosamines, which are cancer forming. And that's one of the main reasons we see gastric cancer in countries like Japan, because they also eat a lot of preserved foods and don't eat much in the way of fresh vegetables and fruit.
Are fermented fruits and vegetables in the same category as preserved fruits? Is that what you're?
No, fermented is not necessarily too good if they contain nitrites in them. It just depends how they've been fermented and really.
Sauerkraut and pickles and all those other Jewish Eastern European.
We have to look to see if there's anything that has an N on the label, then you have to be careful. But you know, saltpeter is potassium nitrite. Saltpeter is commonly used to pickle foods.
Mm-hmm. I know it's used in pickled brisket and all the pickled meats.
Well, nitrites get broken down into nitrosamines. That's the problem. Really.
Well, Sam, if we were in town and if we weren't in this lockdown, we would all be agreeing to take a walk on the beach at this point in time. Being that we are all safely ensconced in our little bubbles, if you want to venture out individually and take a walk, you're welcome to do that now, all in light of keeping well. What's that you have there, Dr. Mantel? Oh, his chocolate bar. Yeah.
It's dark chocolate.
Our favorite.
I'm going to have some of this and sauerkraut, and then we're going to go for a walk.
Exactly. All right. Well, I think, thank you everyone for attending our pilot program of the Adat Wellness and Health Club, and Mike Mantel for originally giving us the suggestion, Sam Marcus for his wonderful insight into a healthy gut. Don't all rush out to go buying at Whole Foods now, because you'll be safe. Or if you like, you can go look at Whole Foods and then walk over to Trader Joe's and see how much money you're saving.
Chocolate there.
And feel rich for the day. You can also get a good bar of chocolate from Trader Joe's. And Rabbi Reich, thank you very much for your words of inspiration. And please God, we will do this on a monthly basis. And one day we'll all be able to get together and take a walk and enjoy 3 cups of coffee together.
Please God, yes.
And a box of chocolates.
Yeah,
Thank you.
Once
Well
a week
done.
is fine.
Thank you.
Thank
Thank you.
Thank you. Thank you.
Sam, thank you. Bye, Joanne.
Bye.